Hello friends and welcome back to my channel. This is part 2 for our atypical question, B2B tough questions. So we will continue with the new series of questions. A lot of questions we will see illogical in the video. About the past video or the previous video, please do not forget to check the comment section because my friend is trying to correct some of the thing and trying to comment the more logics for some of the questions. So please try to check the comment section while you are watching the videos. Even with this video, a lot of questions will be atypical and incorrect that I also couldn't make enough sense for the question. So I'll ask my friend while she will watch this video, I'll ask her that she will comment the better logics for all of us. And let's start with today's video. So our first case is for the polycythemia vera. So first question arises here that what is polycythemia vera? So this is a chronic disorder in which what happens is the bone marrow starts to make too much of the blood cells. So what we are going to see in the question, sir, CBC will be affected for sure because as you told that there will be too many of the blood cells. So let's hear it from our patient who is an elderly patient facing headache, itchy skin, pain in toes plus muscles, especially during walking. Skin of the face is red cyanotic tint, lymph nodes are non-palpable. So all of the profile you can read it, but let's go to our favorite part, CBC, which you will see affected in the patient. So erythrocytes are more than a lot of in the number. Hemoglobin is too much in the number. Color index is low here. Leukocytes are increased in number. Leukocytes, we guess that they are in normal ranges up to some 4 to 11 or let's say 6 to 11 ranges. So sir, after in the patient who are having some advanced stages of the age, like some a little bit older age, what happens is their immune response will not appear like too much since let's see here the leukocytes are just 10. So we will consider everything elevated after 7 in the cases of leukocytosis in elderly patient. I hope this is clear here. Platelet should be maximum could be best could be 400, so 500 is elevated. All the other things you can see in the question. So just remember for yourself that polycythemia vera is what, sir, blood will get thick in that cases because too many of the blood cells, so blood will get thick in such cases of polycythemia vera. I guess only one case over polycythemia vera in the KROK can be remembered easily. If I'll find something else, I will let you know in the comments. I hope you are checking the comments because me and my friends keeps on updating some new information over there. Let's go next. Next is our 65-year-old patient have a history of hypertension, complaints, dizziness, palpitation, BP is severely low, ECG shows missing P wave. So sir, the condition of the patient are severe here as the diastolic BP you can see. So what we will do, we'll perform a urgent electrical cardioversion, and later when the patient will be stable, if you think that it will be good to replace the pacemaker, so you can replace it later. But first will be urgent electrical cardioversion because the question is explaining the serious condition of the patient. One question in diabetes mellitus, this question left uncovered, so let's cover it here if it's left uncovered. So a 45-year-old patient having diabetes mellitus, in type 2 change diet has unsuccessful results. So they tried to change the diet but the results were not there. 24 hours glycemia is 10 to 15, medicine should be. So they tried already the diet therapy. This is the case for the diabetes type 2, so which can be treated easily by the means of exercise and diet therapy. So because some of the insulin still releases in type 2, in type 1 there is complete cessation of the pancreatic function. Here they tried the diet therapy. What will be next? Next will be, we'll try the drugs because the 24-hour glycemia is still persisting in the patient. So what we will do, we will try some drugs. So what we will try, sulfanilamide hypoglycemic drugs. So remember the case that type 2 diabetes, when they have already tried the diet therapy which was unsuccessful, 10 to 15 glycemia is severe, but you will prescribe to the patient sulfanilamide hypoglycemic drug. If there is some better explanation, I'll ask my friend to comment in the comment box. So next of our patient is having a road accident, traumatic shock. We about the traumatic shock we have talked in some previous video, and here is the degree of hemorrhagic shock. So I have told you in the last question also that when it is the Krok's degree of shock, then preferable answer will be second degree, but remember a little bit from here as well that these are the normal ranges. So in our patient last time, in the last question also was the second degree shock. So I hope it will make a little bit of sense here, because I know you guys are confused with the traumatic shock or hemorrhagic shock, like which to mark. So sir, if you cannot make enough sense, mark 2 and move on. Next is Kawashior disease. What food to treat? Sir, I have I tried to make some fish, vegetable and cereals for you, so that you can remember. However, here is our mnemonic: functional vital capacity, which doesn't exist though, but it's for your mnemonic for the Kawashior, that functional vital capacity. Or maybe if you have better mnemonic, please let me know in the comments. So what food you will give to treat the Kawashior disease? So this is fish, vegetable and cereals, FVC. Next is our question over a 7th day on the onset. Chills, patient is having chills, temperature, headache, myalgia, face, puffy face. Tongue is dry and chalk dusted. So this is something a hallmark finding for the bubonic plague, sir. So we have to remember about this, that left inguinal area sharply painful and enlarged lymph nodes, skin over the this and this, hyperemic and tense. So here I have written that this is the case related to the bubonic plague. I promise that if I get enough time, I'll do the infections in the detailed version, so that you cover all the parts, even the new questions. But you know that the time is the only problem right now. So we have to remember right now that chalk dusted tongue we see in the bubonic plague. And what is the therapy you are going to provide in the cases of bubonic plague? Streptomycin. Epidemic typhus, doxycycline. Anthrax, penicillin. Some things are good to remember. These words which I just spoke, these drugs of choices, will be in the last photo of the management portion, sir. So you can take a screenshot, remember well. So in the cases of bubonic plague, we will do what? We will prescribe the streptomycin. Hallmark finding for bubonic plague is chalk dusted tongue. It means some white spots are there on the tongue, which looks or which resembles that we have dusted chalk over the tongue. Next is our case over amyotrophic lateral sclerosis. We have talked about it in different video. However, what is the hallmark finding in the amyotrophic lateral sclerosis? That there will be no sensory or coordination disorder, because the problem is with the motor neuron. Next is our case over chronic pancreatitis. Okay, there is something to remember as well. You can read the whole profile of the question. There is something to remember that when Mayo-Rubinson sign is positive, when Ortner is positive, Mayo-Rubinson when positive is there, so this is something hallmark finding for the pancreas, that pancreas inflammation is there. Another things what can make sense here is here is written that left subcostal region. So this is also typical finding for pancreatitis, which irritates to the lumbar region due to inflammation. Vomiting brings him no relief. Burning sensation, there are signs of appeared after the meal. So pancreas is inflamed here. When the patient eat food, is what happened is the enzymes were not secreted in the abdomen, and the sign appeared after the meal because pancreas inflammation is there. The enzyme did not got released in the stomach easily, sir. So Ortner is positive. Mayo-Rubinson is very typical for the chronic pancreatitis, and remember to mark which stage is this? Chronic pancreatitis in the exacerbation stage. So remember to remember about the hallmark findings for the chronic stages of pancreatitis. This Mayo Robinson, left lumbar left subcostal region pain radiating to the lumbar region. So this is something hallmark findings here. Next question, next is our 10th patient. That bronchoscopy says what? Bronchoscopy shows EMPH pneumocysta. So EMPH pneumocysta means what? Pneumocystitis carni in the lavage fluid. Which lavage fluid they are talking about here, sir? In the bronchus they are talking about the lavage fluid. So what medicine to prescribe in the cases of this pneumocytitis or pneumocystitis? So the medicine you will prescribe is Biceptol, cotrimoxazole and clindamycin. So remember about this medicine that I told you in some different video that this EMPH doesn't make sense to me. If you know about it, let me know in the comments. But remember about this EMPH pneumocysta case, that in the cases of pneumocysta carni in the lavage fluid, which are the bronchoscopical finding of the patient, what medicine we will prescribe? Sir, we will prescribe the cotrimoxazole, Biceptol or clindamycin. So let's go next. Next is our case over hysterical neurosis. We have covered it in a different portion. Next patient is 12th patient. 12th patient says what? A 28-year-old woman, pain in the lower abdomen, more on the right. During menstruation, increases during menstruation. So smearing bloody discharge before and after the menstruation. 10-year history of infertility. And uterus is dense, painless, not enlarged. And to the right, there is a mass which is this and this size, slight limited mobility diagnosis. Now hear to me very carefully, friends, that in the cases of endometrial, this 28-year-old woman has pain in the lower abdomen, more on the right, and increases during menstruation. This is a finding typical for endometriosis as well as some another findings as well, right? But do not already mark the answer as endometriosis, right? We are trying to build up the concepts together. So we will read the whole question, sir. So smearing bloody discharge before and after menstruation, this is also something typical for endometriosis, that before menstruation, after menstruation, even after the menopause also the endometriosis occurs very rapidly. So she has a 10-year infertility. So this is also typical for the endometrioid. So uterus is dense, painless and not enlarged. This is not the finding related to the endometrium. That said, uterus will be painful or well, it depends. It can be painful or painless at the same time, or in some atypical cases not enlarged. So this is not hallmark finding for the endometriosis. However, there is some mass is given over there. So sir, this is not simple endometriosis. So this is the case of what? Sir, there is endometriosis. We see in the question a lot of findings are there related to the endometriosis, but they give you some mass over there. So what is there? Endometrioid ovarian cyst on the right. Sir, why on the right? Because the pain is where is that? Uterus is dense, painless, not enlarged, and to the right, because the mass is present on the right side with the slight limited mobility. So mobile and slightly limited mobile things are what? Sir, cysts are more commonly slightly mobile. And cancers is what? Cancer is irregular hard mass which will be more limited to the mobility, will be very less mobile, and tumors will be more mobile than all of them. So I hope you remember this Kandinsky syndrome. We have talked about it. Hallmark finding is controlled by the external forces. Next is the case over. So I think the same case we have done already, that when the question says about edema in the lower legs. So sir, we will remember you have told us that this is the case related to the DVT The question is trying to highlight DVT by saying the edema in the lower leg, sir. We will remember it. So hallmark finding here is ECG findings. So S1, Q3, T3, which are the hallmark findings. What happened in the patient? Pulmonary thromboembolism. How it will happen to the patient? Sir, it will happen suddenly, severely, gravely, with the very low BP findings. So next patient. So the boy has stuffy nose, and the condition occurs in the spring and autumn. So history is having atopic dermatitis, which is allergy type thing. So further is bronchial asthma. Father had bronchial asthma, also allergic history, sir. Anamnesis also states some allergic or some problem related to the eosinophils. Rhinoscopy detected what? Swollen plus pale nasal mucosa. Suspect what? So in the question, just rhinitis will be given as well in the question. So sir, we will mark rhinitis in some different cases. However, there is no particular question over just rhinitis. The question is over the allergic rhinitis. Sir, why allergic rhinitis? Because this is seasonal problem, and also the family history also states the cases of allergy. That's why allergic rhinitis. Next is the question over Cushing disease. You can read the whole profile, and the main hallmark finding for the Cushing disease is what? Sir, ACTH level when increased in the blood. This is something hallmark finding for the Cushing disease. So what we will see in the patient is hair loss, fat deposition where? Neck region, torso region. In the option, dysplastic obesity will also be given, but that is a something different profile. Maybe they both looks the same, but when you will mark dysplastic, sir, when we will see, the question will say disproportionately thin limbs, then will be the answer what? Then will be dysplastic obesity. And here what is there? When you see ACTH levels are increased, what you will mark? You will mark Cushing disease. However, if you would love to remember about all the things, let's hear it with the mnemonic, which is Cushing's itself. So Cushing is central obesity, unusual hair loss, striae, hypertension, increased ACTH, and glucose intolerance, and skin changes. So sir, this is the mnemonic if you would like to remember all profile of the Cushing disease. However, from now you know that ACTH raised in the blood is also a hallmark finding for the Cushing disease. You can remember through the mnemonic as well, and you can learn about from the hallmark finding as well, as you like. Let's see our next is I have collected some cardiology drugs for you. In case when the brain stops braining, what you will do is you will try to recall some names of the drug and act according to the condition. If the question asks about some drug of choice and you forgot about what to mark in such cases, so maybe in this table I thought it will be helpful for you a little bit. You can take a screenshot also, and I will post my notes in the notes section. The link will be in the description. Let's hear it one time. So in antihypertensive drugs are enalapril, amlodipine, hydrochlorobenzathiide, and bisoprolol. Many more will be there, but they are some of the drugs which are more good for KROK's treatment, or let's say our modern techniques are also involved in this. Heart failure, what you will give? Furosemide, spironolactone, digoxin, enalapril, bisoprolol. In the cases of MI, what can be given? Aspirin, heparin, nitroglycerin, morphine, clopidogrel, and atorvastatin. I also did not hear it before. Antiarrhythmic drugs are amiodarone, lidocaine, verapamil, digoxin, and adenosine. So these are the drugs. If you forget sometime in the question, these are the drugs which you can use sometimes and remember for the better learning. Next is this AMP. They disturb me too much. EMPH, AMP ka C2. So remember, when MCA-C2 is given in the question, what you have to mark? Cervical colonization. However, let's see the whole case. So the case says that 32-year-old woman during the occupational medical examination underwent a colposcopy that revealed this area in the zone of 1 centimeter uterine cervix. Cytologically, there were dysplasia of the third degree detected. After the additional examination, the patient was diagnosed with MCA in situ of the uterine cervix. So, what treatment of the method? What treatment method should be chosen in this case? What did they find? They revealed the punctation in the area of zone 1, and the patient was diagnosed with MCA in situ of the uterine cervix. So what will be the good tactics in this case, sir? Good tactics will be cervical colonization. Our next patient is a 16-year-old girl who is having fatigability and dizziness. She is having a systolic murmur in the second subcostal area along the breastbone edge on the left. ECG shows right ventricular hypertrophy and X-ray shows dilation of the pulmonary artery. Trunk is enlarged and right heart. So dilation of the pulmonary artery is there because some pulmonary hypertension is there, or let's say it can occur in the cases of some hypertension, or in the case of, let's say, when there is some sort of stenosis. So why the stenosis will affect it? So if the in the pulmonary system, when from the pulmonary artery, if the blood is not going out or not draining out due to the stenosis, so it will cause a little bit dilation of the pulmonary artery because some stenosis is over there, and also the systolic murmur is over there. So this is the case related to the pulmonary artery outflow stenosis. Next is Panday's reaction, or you can say Panday's reaction. So this is the case related to purulent meningitis, P for Panday's reaction and P for purulent meningitis. So Panday's reaction means what? Means increased in protein levels. So let's hear it from the patient also. What are they complaining? 4-year-old child, acute temperature increase, multiple episode, vomiting, tonic-clonic seizures, and general hyperesthesia, objectively sluggish, nuchal rigidity. All right, so neck stiffness is typical for meningitis, and CSF is turbid here. So a P for protein increase, P for Pandey reaction, P for positive, and P for purulent meningitis. So please remember about the case, guys. Panday's reaction, protein, purulent meningitis. So you will remember it. Let's go next. Next is our case over Bruton's disease. So what is Bruton's disease? Also known as, so this is a disease which is also known as hereditary gamma globulinemia. So what happens is the immune cells, the immunoglobulins are having problematic. What happens is the body fails to produce enough of the B cells. So there will be low level of when the B cells are not enough formed in the body. Hence there will be the problem with all the immunoglobulin, like the G will be low, IgA, IgM, IgE, all of them will be low. Let's see the patient. Mother of 4-year-old boy having frequent infection in her son. At the age of 2, he had an abscess in the forearm, frequent cases of bacterial rhinosinusitis and pneumonia. So the patient or the infant is prone to the bacterial infection. I have written it here that recurrent bacterial infections are there. Hypoplasia is there. Objectively, hypoplasia of what? Tonsils and lymph nodes. So as you can see given in the question, all the levels of immunoglobulins are low here. And however, the question as you can see, the level of E immunoglobulin seems 88 here. So in the question the IgE 88 and the option IgE deficiency or something like that, or IgE something will also be given in the option. So please do not mark that. Remember that the congenital defect of tyrosine kinase is the case of Bruton's disease. and a lot of CD3, CD4, this and this values are given in the question. But remember, when all of the immunoglobulins are given in the question, please do not mark IgE for that question. You have to mark Bruton's disease. And however, Bruton's disease, what's the problem is there? So the tyrosine kinase is problematic. So the B cells are problematic, which are not produced in our system. Hence, there will be a deficiency of all the levels of immunoglobulins. Next is our favorite case, when the respiratory infection will catch what? Will catch the myocardium of the heart. So remember about this. We have talked in in last video as well, that after the cases of acute respiratory infection, the bacteria loves to travel to the myocardium of the heart. Hallmark finding will be, sir, myocardium is affected, so heart border extended to left, so a dull heart sound, sir. Myocardium is affected, dull heart sound. That's why low intensity, sir. Why low intensity? Because myocarditis, my dear, the inflammation, the layer of the heart which pumps the blood outside of the ventricles will, as is got inflamed right now, has had some inflammation right now, so it will not be able to pump the blood effectively. So what happened will be low intensity waves. We will see that it is trying but unsuccessful. Yeah, reaches its max at the fifth point, and you can read the whole profile. Remember, most probably when there is upper respiratory tract infection given, or acute respiratory tract infection is given, or infection is given in the history, now the bacteria will love to go where? To the myocardium, sir. So next is our patient bitten by the dog, and bites by dog bited what? Face and fingertips. So what are the treatment tactics according to the KROK 2 test center examination center? So sir, in the anti-rabies will be given two times in the question. I have checked the other options, that what you will give, sir, you will give immunoglobulins as well, you will give vaccine as well. So okay, remember about this case, friends, that in the test center it is given that boy is bitten by the dog. So what tactics you will do, sir? The question should contain anti-rabies word two times. So what you will do, prescribe anti-rabies immunoglobulins plus anti-rabies vaccine. Also we need to provide. Why, sir? Why vaccine and immunoglobulin, everything, sir? No history is given in the question that the boy is vaccinated or not vaccinated. So what we will do is, we will take the emergency care plus we will take the preventive care. We will prescribe the immunoglobulin for current condition, we will prescribe the vaccine against the prevention. So next patient says what? Peeling of the skin. Peeling of the skin is typical for retinol, vitamin A. We have to remember about this, sir. And also what they say, examination shows what? Papular rash plus peeling of extensor surface of her knee. So in the area of the hair follicle, there are wax colored nodule raised from the skin. Insufficiently dietary intake of retinol, sir. For sure, retinol, peeling of skin, and peeling of papular rash plus peeling of extensor surfaces. So what is the main problem in this question, in the patient, in the woman, is peeling of skin. What should be the treatment? Retinol, sir, vitamin A. So maybe retinol is given, maybe vitamin A is given in the question. Remember about it, sir. If the patient says about some erosions in the mouth corners and some cheilitis is given in the question, what we will mark, sir? You will mark riboflavin or vitamin B2. So remember about it. Riboflavin is vitamin B2, I guess. Yeah. So riboflavin is related to cheilitis. Next is our case over beds. We have covered in different portion. Kwashiorkor disease suspected. Factor causing this disease, what factor is? Deficiency of the animal proteins. So in the disease Kwashiorkor, so what you have to remember is deficiency of the animal protein. As you can see that I tried to draw some beautiful animal for you, but I got failed successfully. Yeah, because I have lesser time. when I was in childhood. I was one of the best student with the art and craft, but now no time even for the diagram. So remember that my irregular animal looks like amoeba is still but this is the case related to kwashiorkor, which is the deficiency of animal protein. So let's go next is the case over dermatomyositis, which we have covered in another portions. So let's see the question once again. What is our loss with that? 12-year-old having high temperature, muscle pain, difficulty swallowing food, periorbital edema with the pink tint, muscle tone is decreased, capillaries in the area of the finger pads and palms, extended borders of the heart, muffled sounds, hepatosplenomegaly, increased level of creatine in the blood and urine. It means kidney are involved. So dermatomyositis, sir, what is this? I hope you remember that this is a autoimmune process, autoimmune disease which will affect what? Dermato plus myo. So it is written here that the dermatomyositis will affect what? Sir, dermatomyositis will affect derma plus myo. Okay, the skin and muscles. So what system is involved here? Kidney is involved, sir, here, and muscle pain is given in the question, and periorbital edema. Remember that in the cases of dermatomyositis we have talked about it. We will see Gotron lesions as well, which are some sort of shiny scales over the hands, and this is not the case of psoriasis. That Gotron lesions when given in the question is also the case of dermatomyositis. Next is our patient says what? 28th question. Let's read it here in the full version. When playing football, 20-year-old man was sharply hit his leg or sharply on the leg. So the movement resulted in the sharp pain in the right knee, after which he was brought to an first aid section station. Objectively, the range of movement in the right knee is 100 to 150, which is lower than the required. There is no lateral mobility in the knee. Make the diagnosis. So sir, when there is a, what is given in the question? Sharp pain is typical for the damage for the internal meniscus, and other things if you will see will not make sense in this question. So range, when you see in the question that there is a sharp pain while playing football, some hit is there or some what is there, man squatted sharply on his right leg. When the sharp pain is there, plus when the range of movement is reduced to 100 to 150, plus when there is lateral mobility in the knee. So sir, mark the damage to the internal meniscus. These are the typical finding for internal meniscus damage, and move on. Next is our 29th patient. Says what? Left foot is bluish black in the color. Sir, bluish black in the color, grade of diabetic foot according to the Wenger. I have put photos in the reels portion. If you want, you can see the stages of cancers, diabetic foot, and a lot of many more things. But remember that this is the direct question about the stage 4 of the diabetic foot, that when the left foot is appearing bluish black, so this is the case of fourth degree diabetic foot grade. So next is a case over molar pregnancy. We have covered it in gyno portion already, but what are the hallmark findings? Vesicles with high gonadotropin level in the blood are typical findings for the molar pregnancy. Next is our case over, again the case over atrophic of fundic mucosa. We have done it. The case of autoimmune gastritis, which will produce antibodies against the parietal cells. Next is our case over botulism. So one more thing to remember, I have highlighted it in the botulism portion as well, but here as well one more time, let me make it for you. So when the botulism symptoms has appeared, some of them, not all of them, but what they were eating is homemade salted fish. So how to remember it? That you remember from the botulism that canned food the patient would be using. So the homemade salted fish, the mix makes sense like this way, that fish will smell very bad, so until it will be ready to eat for them, and until then they will keep it in a tight container so that it doesn't leak any sort of smell or any kind of so when they made it homemade salted fish and put it in a canned container, so what it caused, they ate it and got botulism. So this is how you have to remember this question, that homemade salted fish is there, after eating them the patient got botulism. So next patient we have talked about this hepatic dullness absent. This is repeated question, remember guys, hepatic dullness absent, we have covered it in the last video as well. Next is the case over aneurysm. So a sudden sharp pain in the chest cavity, elderly patient with the sudden sharp pain in the chest cavity, lifting a heavy object, localized central to the chest, doesn't irradiate to other areas, doesn't intensify with changes in the position of the body, nausea without vomiting, no respiratory symptom is observed. Risk factor is what? History of essential hypertension. It takes ACE inhibitors, cardiac enzymes, skin is pale and moist, pulse is high, respiration is fine, ECG shows sinus tachycardia, and what is there? Chest X-ray shows the darkening in the upper left plus lower right segments. So sharp pain has occurred in the patient's chest. First of all, the main risk factor in the question is, sir, essential hypertension. This is something risk factor for the another complications with the patient. So the essential hypertension patients are more prone for the aneurysm, or more probably for the dissecting aneurysm. What happened is the patient lifted an heavy object and then he noticed the sudden sharp pain in the chest cavity is there. So what would have been occurred, sir? The aorta could rupture easily because the patient is having already the essential hypertension, so he is already more prone for the aortic tears. And for the KROK style answer, what you will mark is, this is dissecting aortic aneurysm case, that the aorta got ruptured. Since the patient lifted the heavy object and he was having the history of hypertension already. Sometimes the ECG will show the signs of MI, as in some question was mentioned. Next is our case over acute metro, and this we have covered in the gyno portion. You can watch the video over the gyno portion. Next is preterm birth question. Okay, this is the question. The definition of the students criteria I have highlighted in the social medicine, but let's see the question here. Every 100 birth, the woman with the risk factor is 30 gives the preterm birth. Woman with risk factor without risk factor give 5 preterm birth. So methods to calculate this. So this is a difference between two comparable groups. So this is not the correlation coefficient. This is what criteria? Students criteria. What is correlation coefficient? Correlation coefficient is the measurement between a phenomenon and some factor. Phenomena, for example, blood pressure. Factor, for example, age. But students criteria is the difference between two comparable groups, like both they compared the woman with the pregnancy with risk factor and without risk factor. So they compared the comparable groups. So this is the calculation for the students criteria. And next is finally a question over good pasture syndrome. I was looking for it. So macrohematuria we see in the cases of good pasture syndrome, dyspnea and hemoptysis after a case of acute respiratory viral infection. So this in good pasture syndrome, what happens is, this is glomerulonephritis plus pulmonary hemorrhages. What is good pasture syndrome? Good pasture syndrome is a autoimmune condition which will be affecting the glomerular basement membrane, and it will be affecting the lungs as well. Which part in the lungs, sir? Alveolar membrane in the lungs. So remember about the good pasture syndrome once again. What is this, sir? This is the autoimmune reaction which will affect the glomerular basal membrane plus the alveolar membrane. So due to which what we will see in the patient, glomerulonephritis plus pulmonary hemorrhages. This is autoimmune condition with the lungs and kidneys. So let's hear it from the patient. As the problem is with the filtration this time, as glomerulonephritis as we see in the patient. So nephrotic syndrome is proteinuria and nephritic syndrome is hematuria. So this is the case of glomerulonephritis. So macrohematuria we will see in the cases of Goodpasture syndrome or in the cases of glomerulonephritis as well as if it is nephritic syndrome. Yeah. So dyspnea, hemoptysis because what, the alveolar membrane is also affected, sir. So macrohematuria together with the hemoptysis typical for Goodpasture syndrome. Also a case history is given, acute respiratory viral infection. However, we got our good findings. X-ray shows what, bilateral disseminated damage within the 2 weeks, condition deteriorated. Of course the condition will deteriorate if there is alveolar membrane damage. Yeah. Let's move to the next question. I hope you will remember that Goodpasture syndrome will give you macrohematuria plus hemoptysis together because the problem is with the autoimmune process with the damage of lungs and kidneys both. What will be affected? Glomerulonephritis, pulmonary hemorrhage will be there. Next is 60-year-old man, memory disturbances, coordination gait, cerebral arthrosclerosis was confirmed. So now the BP is in norms. MRI shows leukoariosis, which is white matter changes. So problem with the white matter changes in the periventricular area. What is the diagnosis? So this is the case related to the hypoxic ischemic encephalopathy, that the patient is having some cerebral arthrosclerosis and the person is having memory disturbances and coordination problems. So the problem here is the ischemic encephalopathy is there due to some hypoxia over there. Hope you'll remember the case. If my friend has better explanation for this question, I'll ask her to comment in the comment box. No need to worry about it. So next patient is a factory worker with the harmful condition. Complex of measures is being taken to reduce the morbidity among the workers. So they are trying to reduce the morbidity among the workers. Type of morbidity requires distinguishing such a group of people who fall ill frequently for a long time. So they are looking for the people who fall ill very frequently, means who are more prone to the health infections and who stay ill for the longer time. So what they are looking for, what they are doing for, so they are doing the morbidity. What kind of morbidity they are studying? Morbidity with the temporary disability. Sir, please remember about this case, that they are looking for the people who fall ill frequently for a longer time. So what are they looking for? They are looking for the morbidity with temporary disability. I hope you will remember this case, that social medicine questions are not very tough, but let's say we have to remember about some things. So some things which are not covered there, I am covering them here. So people who fall ill frequently for a longer time, so this type of morbidity is the type of morbidity which studies the temporarily disabled people because they are falling ill frequently for a longer time. Let's see our next patient. Okay, next patient again says that the x-ray shows air under the dome of the diaphragm. Peritoneal irritation is present. Sir, hepatic dullness would also be absent in these cases, or so because air is there under the diaphragm. Yeah. So perforated ulcer of the stomach or duodenum. So we know about this case, we studied about this case already. Next is pyelonephritis. We have talked about it already. Let's see. The question gives what? Okay, this question my friend asked me just some hour ago, and I see it in my notebook now. Main thing is I wanted to tell you that in something is added in the profile of pyelonephritis, that a bacteria can cause what? Look at the CT scan findings. The bacteria can cause no difference between the cortical and medullary layers, that they are severely destructed by the bacteria. Pyelonephritis is a bacterial infection, yeah. So the bacteria can damage the layers of the adrenal, or let's say the kidney layers. No difference between the cortical and medullary layers, so the bacteria destructed so severely. So, and what were the hallmark finding for the pyelonephritis is pain in the right lumbar area. And what else is there? So turbid urine with the blood can be there, yeah, because bacteria. And fever will be there, sir, because bacterial infection. What else is said? Increased density of the perinephric fat due to edema. So main thing I wanted to tell you about the pyelonephritis, that the bacteria can cause this much severe destruction that no difference between the cortical and medullary layer has been left. It has erased the identity or clear borders of the cortical layer and medullary layers. All right. Next is our case over. 17-year-old girl, profuse bloody discharges from the genital tract, cramping pain in the lower abdomen. Her menses lasted 10 weeks ago, and the vaginal examination shows the external OS of the uterine allows inserting a one finger. I think I have explained the same question in the gyno as well. But let's hear if I have missed. So her last menses was 10 weeks ago. First of all, the question want to highlight that the woman is pregnant now, and profuse bloody discharges from the genital tract because her pregnancy got miscarriage right now. And what made me think like that? So because the external OS of the uterine allows inserting one finger, so through which the bloody discharges, profuse discharges are occurring. And although she is young for the pregnancy, so a lot chances for the miscarriage. So when the profuse bloody discharges are already there, we are sure that miscarriage has occurred already. Completely or incompletely, we don't know yet about that, so we will mark the answer incomplete miscarriage. Remember that when the KROK question says last menses were 10 week ago, they are trying to highlight that the woman is pregnant again. All right. Next is empiric antibiotic therapy is what? Ciprofloxacin. So when the question asks you what is empiric antibiotic therapy for some particular case, sir, you will give ciprofloxacin, which is also helpful in the cases of urinary tract infections. So dry cough. So dry cough is caused by lisinopril. So lisinopril is a, remember guys, lisinopril is a ACE inhibitor which will cause the side effect dry cough, which is most common side effect caused by the ACE inhibitor named lisinopril. Next is discussed toward meat cytology. We will do. I have covered this question in some another portions like management or in investigation. Probably I have covered it in the full question in the investigation portion. Next is what? Next is the case over cephalhematoma and craniocerebral birth injuries. I think this was the case related to the cephalhematoma. So most common chances are from the cerebrocranial birth injuries. I have covered this full question in the cases of intracranial hemorrhages. You can watch this over there. 42-year-old. Next is a good case finally. So the case is related to the nodular uterine leiomyoma. So uterine fibroids. So let's hear it from the patient. The symptoms you can remember I have told in the uterine fibroids in a different video. Aching pain in the lower abdomen, intensified painful menstruation, history to abortion, no childbirth. Objectively, skin of the abdomen is soft plus painless. Tumor like mass is palpable above the pubis. Bimanual examination, body of the uterus is enlarged up to 14 weeks of pregnancy. Dense mobility, uneven surfaces. appendages are not palpable. So this is the typical case related to the uterine fibroids, sir. What happens is the pain is of the itching in natures, and pain during the sexual intercourse. So dysmenorrhea and a lot of symptoms are related to the uterine fibroids. So she also has a history of 2 abortion plus 2 childbirth. I'll ask my friend to make more sense for this question, so she will comment it in the comment box. Let's see our next patient. Next patient is I think, yeah, we have covered it in gyno, but let's see one more time. A 28-year-old woman having severe mental trauma, heavy bleeding, started on the 20th day of menstrual cycle, continues to 2 week. External genitalia are good developed. So cervix is cylindrical and clean, which is good here. Body of the uterus is normal size, painless, which is also good here. Vaginal fornices are deep and parametrium is free, which is fine. Vaginal discharge is hemorrhagic plus profuse. So what is the cause of this hemorrhagic bleeding? Sir, dysfunctional uterine bleeding. No another pathology is involved here. What is the cause of heavy bleeding? Just dysfunctional uterine bleeding. Next is the case over. A 42-year-old woman lost her consciousness after physical exertion. BP is this and this. History of glucocorticosteroids from 5 years. Bronchial asthma and sluggish. Skin is normal, heart sounds are increased, pulse is 100 and rhythmic, and poor volume. Glucose is 3, sodium is low and potassium is high. Sir, remember about this case that we talked about the acute adrenal insufficiency, when the hormone levels are disturbed, sodium and potassium probably, when there is a BP is disturbed. So you can remember through the mnemonic the case of acute adrenal insufficiency, SSSSS. So sudden collapse, sudden weakness, super low BP, salt loss and sugar low. So remember about this. Pentard. This is not triad, this is not tetrad, this is what? Pentard. So acute adrenal insufficiency. Let's see once again in the question that the patient lost her consciousness. So we got our sudden collapse. So the patient is in the severe weakness. We got our weakness in the question. So the patient is having super low BP. Is the BP super low? Yes, sir, exactly. We need to go for some emergency procedures as the diastolic BP is just 20. Next, what is the salt loss, sir? We see the salt loss. Normal values of sodium is 135 to 145 something. So it is low here. Potassium is elevated here. Low sugar, sir. What are the normal sugar levels? Where is sugar? Glucose, okay, 3.0. Sir, at least it should be 5. Up to 5 should be normal. This is low here. So sir, remember about the acute adrenal insufficiency with our S mnemonic, which is our not triad, not tetrad. This is pentad for our acute adrenal insufficiency. Next is we keep on talking about this sulfur gas all the time in all the corners, just to make sure that my friends doesn't mark it wrong. Sulfur gas effect is chronic, non-specific. Next is hydradenitis. So we have talked about it in a different video, but what's the hallmark finding for hydradenitis? So this is more common for the axillary region. Next is our case over a secondary para. We have covered it in the gyno portion. Yeah, I'm sure that I have covered it. Bloody discharge from the vagina. Onset is full delivery. Cervix is smoothed out. Internal spongy tissue. Yeah, we have talked about this case. Reach out the video of gynecology, which will build up your all concept in deep knowledge. Our case 142, 142nd patient saying what? The patient saying about the 30-year-old says the itching rash on his feet onset is 3 years ago. The soles of his feet are there are clusters of vesicles that resembled boiled sago beans. So remember, there is something other which the KROK examiner is trying to twist for you. That sometimes they say boiled meat, and now they are saying that sago beans are there. So sago beans as well as some erosions are there in the question, and interdigital folds have what? Fissures plus erosions. So this is the case of dermophytosis of the feet, which is caused by Tinea pedis. So remember about it. I see only one case over there is in the KROK questions. So epidermophytosis of the feet is simply the soles of the feet. There are clusters and vesicles on the sole of the feet, and that resemble the boiled sago beans. So remember about this sago beans. When the patient is having dermophytosis of the feet will resemble, or the vesicle will resemble, the boiled sago beans. All right, I hope you will remember the case. So let's go next. Next is our general weakness, fatigability. Our patient number 143. So he is complaining about the general weakness and increased fatigability, numbness and tingling in the hands observed for the past 4 months. And objectively, temperature is there, which seems fine to me. And erythrocytes are low, hemoglobin is low, leuco low, ESR elevated, platelets are okay. And nowadays I learned about these CBC values this much, that from the question I doesn't write the values. I write is what? This is low, this is fine, this is okay, and all. So I think from a lot of questions we have covered with me, so you might have come to know about the normal values of the things. Also, I have updated the notes of the hematology in the notes portion. Please reach to the notes, take screenshot for yourself so that you remember in this. Microscopy of the blood smear shows what? Megalocytosis. Sir, megalocytosis is related to mega anemia, sir. Megalocyte is related to mega anemia, which is B12 deficiency anemia, or we say what? Folate deficiency anemia. Please remember about it. I think you will remember the B12 deficiency anemia is there. So now please remember about the folate deficiency as well, that the question may not always give you just B12 anemia. The question may also highlight about the folate deficiency anemia. So next is our patient over elementary constitutive obesity. So you have to remember about this case as well, friends. What the case says it, that there was a 13-year-old girl who had 30% of excess body mass, subcutaneous fat evenly distributed, and had a juvenile acne on her face. So please remember this case. I know that making sense in such question is a bit difficult, or we need to learn very deep knowledge for that. But we can remember some things with the mnemonic, yeah, from the social medicine or such atypical questions. So remember that there was a 13-year-old girl who had a 30% excess body mass, and she had a juvenile acne on her face. Her body fat was evenly distributed. So in cases of elementary constitutive obesity, the fat is evenly distributed. Now it will make sense, yeah. So next our patient is complaining about the temperatures 2 days after the recovery from the upper respiratory tract infection. So now where the bacteria will go? Now the bacteria will go to myocarditis, yeah. To the myocardium, we have talked about it. So first heart sound is weakened, sir, because the myocardium is not able to pump well, because the bacteria catched it, bacteria got it inflamed. So there is first heart sound is weakened because the myocarditis or myocardium is unable to pump effectively. Short systolic murmur in the fourth intercostal area near the left edge of the breastbone. Sir, I think we have just seen the similar case in some minutes ago. This is what, this is myocarditis, sir. Sir, is it rheumatic myocarditis? Sir, no, this is not rheumatic myocarditis. What is missing in the question for marking the rheumatic myocarditis? Or sir, missing is joint pain is not there. Is not there, yeah. Suffocation and this, yeah. So what is typical for the rheumatic fever or rheumatic myocarditis? Sir, there will be the whole triad: tonsillitis or URTI, kidney and joint infected, and systolic murmur in the on the apex, maybe, I guess. But systolic murmur will be there, remember. So this is the case of non-rheumatic. So the examiner will give you rheumatic myocarditis also in the question. But remember, for this case, what is missing in the question to mark the rheumatic version? Sir, the joint pain is not given in the question yet. We know from before that joint pain will also be there in the cases of rheumatic fever. Next is our beautiful woman with the paroxysmal hypertension, 240 to 120, very severe. I'm already suspecting some problem with the renal system, or maybe some problem with the hemorrhage. Nausea, vomiting, tachycardia, excessive sweating, hyperglycemia. After the episode has profuse urination has occurred. Renal sonography shows formation adjacent to the upper pole of the right kidney that might belong to the adrenal gland. Sir, we have talked about this question in the portion in the portion tumors pheochromocytoma. I have told you that in the cases of pheochromocytoma, the BP cannot just go to up to 240. The BP will go up to 260 as well. Yes, sir, 280 as well. This happens in the cases of pheochromocytoma. So blood test, what we will do, sir, which hormone is released by the adrenal gland? Catecholamine, sir. Catecholamine can be the cause of BP deterioration in the patient, or severe BP in the patient. So what we will do is, we will try to take the blood test, urinary test, which will be highlighting urinary excretion of the catecholamines, and plus another some acid is given over there. But I use catecholamines as hallmark for myself, that catecholamines, I know that they will raise the BP. This is what I'm using. So let's go to our next patient. Next is age, sir. Age, you have told us many times, is a uncontrolled endogenous factor. So next is our patient about the trauma. Trauma has occurred in the patient, which is what is given here, sir? Anisocoria. Anisocoria, you have told about us that also a sign of brain herniation. So what we will do is, electrodes will not work this time. We will have to go for CT this time. Next is asking about the phase of the sepsis progression. So after a surgery, let's hear it from our patient itself, that what the patient is saying is, after a surgery, left thigh and phlegmon is complicated by sepsis on the seventh day. Seventh day after the surgery, inflammatory reaction, blood is having toxic anemia, hypoprolactinemia progressing, which is progressing, bilirubin and AST and ALT exceeds by 2.5 norms, oliguria persists, 700 ml per day, phase of the sepsis progression. Sir, which phase it should be according to you? So it is catabolic phase. Another options will be given: anabolic, catabolic, recovery phase. Sir, this is catabolic phase, in which the body's severity is given in the question. The the examiner want to highlight the severity grade of the question. Catabolic means what? The deteriorating, the breaking portion, yeah. So AST and ALT, as I see, are exceeded by the 2.5 times still. They are still 2.5 times elevated, yeah. Shows the deterioration of the patient. Oliguria still persists, sir. 700 ml per day is a significant oliguria. So which kind of phase this is? Blood is having toxic anemia. So what case is that? This is the case of catabolic phase of sepsis progression. This is not looking like the recovery phase. Let's see our next patient. Remember that series starts from number 1 from here again for the questions. There was a girl where girl receives the insulin injection. She developed something and something for over there. What she would have developed, sir? She would have developed the hypertrophic lipocystrophy. So remember about it. Although you have seen this question a lot of time, I know about it, but I just wanted to make sure that you know the answer. So this is the case over when where the girls was taking the insulin injection. What is developed there, sir? Hypertrophic lipocystrophy is developed over there. Next is the case over adenomyocytes, which is covered in the gyno portion. What will happen in this? There will be ultrasound findings are important, which shows isolated foci, increased echogenicity in the myometrium. So the problem with the endometrium has traveled to the myometrium now. So what will be the in this case? This is adenomyocytes. You can watch the gynec video for that. Next is cervical pregnancy. For sure would have been covered in the gynec portion. What is the hallmark finding for ectopic pregnancy in this case? Barrel shaped. And what is the diaphragm in the cases of emphysema? So the diaphragm in the cases of emphysema is flat diaphragm. All right, hope you will remember these things. Some of the things are important. Next is and the complication of the ankylosing spondylitis. So sir, what is the complication of ankylosing spondylitis? So anky, the y of the anky highlights the I word. So you remember about ankylocyclitis. So ankylocyclitis. Please remember about it. You will not be able to think a lot in the exam time. So remember about it. Next is our patient complaints of pain attack in the right lumbar region, frequent urination, urinalysis shows mild proteinuria, erythrocytes in the vision field, ultrasound shows moderate urostasis on the right. What we are suspecting, sir? We are suspecting the stone. You have told us that pain can be there in a lot of things, but pain attack, sir, attack is there this time, sir. Attack will be caused by what, sir? Attack will be caused by the stones. So what we will do? Excretory urography. I think we talked about it before as well, but it's okay. Next is again the case over acute adrenal insufficiency. Remember about our mnemonic about S. So apply that mnemonic in this case. You will be able to solve the case easily. Next is our case over tonsillitis. So let's hear it from patient. Our patient is elderly, having chemotherapy, sore throat. Examination shows necrotic areas on the mucosa of the pharynx and the tonsil. So we got something necrotic areas on the mucosa and pharynx with the tonsils. And teeth are affected with the caries. Blood says what? Neutrophilic granulocytosis is there against the background of the leukopenia, represented mainly by the lymphocytes and monocytes. This is the case related to the agranulocytar tonsillitis. Remember that there is a area over the mucosa on the phalanx, which is the tonsillitis is highlighted by the question. Teeth are affected by dental caries, and the patient is taking the chemotherapy. So chemotherapy side effect is what? It will suppress the immune system. So when they suppressed the immune system, some bacteria got a chance to divide and develop the agranulocytar tonsillitis. Please remember about the case. Some more atypical questions are there in this series. And the next question is 5-year-old boy says the pain plus swelling in the right knee. Temperatures are there. And So let's read the full question here. The 5-year-old girl was hospitalized with the complaints of pain and swelling in the right knee joint. Temperature rose up and rash was diagnosed with some erythema. Later, these signs after the recovery, these signs developed after the recovery from the case of acute respiratory disease. Name the atiotropic drug to be prescribed. Sir, the diagnosis in this case is somewhere around post streptococcal reactive arthritis or maybe acute rheumatic fever. What we are going to prescribe is augmentin, which is the combination for the amoxicillin plus the clavulanic acid. Another things which are given in the question: methylprednisolone, sir, this is a corticosteroid. Diclofenac sodium is an NSAID which will give the only pain relief, and methotrexate is used in the cases of rheumatoid arthritis because this is a DMARD category. So now in this case we are going to use augmentin as our perfect answer, which will be our good diagnosis for good treatment for the post streptococcal reactive arthritis as well as the acute rheumatic fever. So remember, I have written here in the question number 10 that augmentin is the combination with the amoxicillin and clavulanic acid, and most probable diagnosis in this case, which we are close to the more close to the acute rheumatic fever. Next our question is over the degree of thermal burn. I have covered the degree of burn in some photogenic session for you, and remember blisters are there which are coming. So the case diagnosis somewhere we can made around the 2 to 3A degree burn pain. Remember, for the KROK question, the burns are more common for the 3rd degree burns, 3A burn, or when 2 to 3A is given in the question, even though if it is incorrect, so you are going with the 2 to 3A degree thermal burn, which is KROK's answer. Next is the case of acute MI. We covered it in the last video that what complication will occur after the MI when P waves are not shown in the question and only the ECG shows frequent irregular waves of varying shape and amplitude. Please remember about the complication of MI here is ventricular fibrillation. Next is our case over the examination shows 24-hour proteinuria 2.2, which is not very mild but significant. 30-year-old woman. Biopsy shows changes in the glomerular capillary walls in the shape of wire loops. Finally, we see those wire loops. So where we are going to see these wire loops? These wire loops we are going to see in the case of diffuse lupus glomerulonephritis. Sir, please remember about the wire loops. When the KROK question is saying about the wire loops, it means the loosed up cells, sir, because the basal membrane of glomerular is unable to filter all of the things, so they are resembling the wire loops because they are broadened up, and they are broadened up, though they are leaking up the proteins through the urine. There is proteinuria over there. I hope you'll remember it. This question, my friend, we discussed about it in the class today. The 200 ml of this time, 200 ml is what here. So this is the case of pulmonary abscess. Remember the case, read the case very well. Cough attack is expectorated 200 ml of the purulent sputum, and round area, sir, round is what? The abscess, the fluid filled cavity is round, sir, in the radicular sense with the horizontal levels also typical for the other pathologies also, but this time remember about the round area will be abscess. In the cases of cancer, we know that there will be hemoptysis given in the question. Next is also the case over the lung abscess. Thank God I collected them together. 60 to 80 ml per day is the purulent sputum, and also wet crackles are there in the question given. Breath is high, right side of the chest, legs behind. So please remember, friends, that one side of the chest, legs behind in the process of breathing, not always is the pneumothorax. It can be caused by another things as well. For example, in this question, abscess is causing right chest, legs behind in the act of breathing. Dullness because some fluid is there, wet crackles because some fluid is there, and round near the ankle of So remember about the case that both the cases are related to the pulmonary abscess. Read the cases one more time in order to make sure to mark the correct answer in the question. Next is our case over bladder extrophy. So what is given in the question is urine is being discharged in pulses from the two orifice located in the lower part of this formation. So more typical what we are going to do is bladder extrophy. So one more time, the examination shows what newborn is with the round red formation in the suprapubic region. Examination shows what urine is being discharges in pulses from the two orifice located in the lower part of the foramen. So which anomaly is there, sir? We are going to do the bladder extrophy in order to check which anomaly is present over there. All right, next question about the C-section. Henkel Western sign is positive. I have told you that it means the obstructed labor, and when obstructed labor is there, so we already meet the complications. What we are going to do is cesarean section. I have sent you the photo of the Henkel Western sign in the group. If I'll remember it, I'll throw the shot over it. And next patient is saying about the 48-year-old patient, pain in the thoracic spine, sensitivity disorder in the lower body, disrupted motor function on the lower limbs, fever is there, treatment is ineffective. Whatever treatment they decided to provide to the patient, pain relief or something, which was ineffective. X-ray shows the X-ray is showing about the destruction of the adjacent surface of the this and this vertebral bodies. In the paravertebral area, there is what, there is the level of lesion, there is an additional soft tissue shadow. Sir, remember about this case, and this is the tuberculosis spondylitis of the thoracic spine. I have been marking it a lot of times incorrect. So sensitivity disorder in the lower body, destruction of the adjacent surface in this and this vertebral bodies, and in the there was tuberculosis case in the would be in the history, but the patient did not state that in the anamnesis. So tuberculosis has already spread to the spondylitis of the thoracic spine by this time. So please remember about this case. When the question doesn't make enough sense, sometimes the answer is tuberculosis as well. However, we see in this case that there is destruction shown in the adjacent surface of the vertebral bodies, and also there is a paravertebral area at the level of lesion. There is an additional soft tissue shadow is over there. So I hope you will remember the case. About the wax colored nodules and the peeling skin. About retinol we have know already. Standardization, this question is here. We have talked about this, that during the analysis of morbidity in a city, age structure of the population is different in each district. The statistical method or statistical method will be standardization. We have covered it in the portion of the social medicine. Here is the question, read it well and remember to mark the standardization. Next is our favorite question. When we were talking about Cushing disease, we talked about this disproportionately thin limbs here. Here are they mentioned, so please remember brittle hairs is the character of dysplastic. ACTH level are not given in the question, so please do not mark the Cushing's disease or Cushing syndrome in this question. So when disproportionately thin limbs are given in the question, so this is the case of the dysplastic obesity. Next is Meyer-Robinson positive, so chronic pancreatitis in the exacerbation state. If the question are repeating, it means I have marked them incorrect a lot of times, so I don't want my friends to mark the same mistakes. So that's why I'm trying to highlight the main portion again and again. Look at this question, I have done it incorrect again, that's why I've mentioned here. So there is surgical sepsis caused by a large carbuncle in the scapular region. So examination shows the secondary purulent foci in the liver and the right lung. Stage of surgical sepsis is septicopymia. We have talked about about this question in previously as well. Next is the case related to the focal pulmonary tuberculosis, which we covered already in the cases of tuberculosis. What is the hallmark finding here? So pulmonary tuberculosis affect the upper lobe of the lung, so that's why there is a dense focus of moderate intensity 6 mm in the segment 2. Segment 2 is where? Near the upper lobe of the lungs. So focus is there, so foci pulmonary tuberculosis. Amylotropic lateral sclerosis, we talked about it. Next is bronchiolitis, we talked about it. Congenital toxoplasmosis, finally. There is a 40-year-old woman, 40 weeks, boy with asphyxia, she delivered. So immaturity sign plus weight is low and hydrocephalus is given in the question. Skin is pale and icterics. Acrocyanosis is observed since already asphyxia is there. Heart sounds are muffled and systolic murmur over all the point. Abdomen is enlarged plus liver is enlarged. Urine is saturated. Stool is light colored. The ophthalmologist says what? Chorioretinitis in the body. So we have to remember about the Toxoplasma gondii bacteria is involved in this case. Toxoplasma gondii bacteria will do what? Sir, it will cause the hydrocephalus, chorioretinitis and intracranial calcification in the body. So after highlighting this portion that toxoplasmosis or in the cases of this congenital toxoplasmic plasmosis is here, I think, in this case, as the case is related to the newborn asphyxia. So please remember about the this triad of congenital toxoplasmosis by the bacteria Toxoplasmosis gondii, which is hydrocephalus, chorioretinitis and intracranial calcifications. I hope the case study will be easier now, because hydrocephalus is given in the question and chorioretinitis is given by the ophthalmologist, and what else is there? Intracranial calcifications. So please remember about the case study caused by the Toxoplasma gondii. And let's go next is acute bronchitis, common in older infants. Inflammation of bronchi, percussion will be normal, distress, coarse crackles, no air trapping. This is something information in some corner, read about it. Next is the case over glomerulonephritis. From 20 years the woman is having, from 16 years she is having the leg edema as well, or parenchymal arterial hypertension, we say. So she is taking what? She is taking losartan and another drug, which are ineffective in order to control the antihypertensive effect. What we are going to do next is the woman with glomerulonephritis history. So we are going to give her toracimide this time, and we are looking for some effectiveness for the hypertensive effect. So remember about chronic glomerulonephritis, and if the losartan is unable to control the hypertension, so what we are going to give to her? We are going to give her toracimide in order to control the hypertensive effect next time. Next is overweight men develop ischemic heart disease. What study you are going to do? Sir, cohort study. Check a diagram over Google about the cohort study. You will remember this question forever. If I'll get some time, I'll arrange the shot for you for the cohort study diagram as well. Next is a employee is sick from the 4 month, so who will provide him further disability exam? We have covered it in the social medicine that this time, after if we want to exceed the holidays of the patient more than 4 months, who will permit it? Sir, a socio-medical expert committee or medico-social expert committee, both are the same things, we know about them. Next is Blumberg positive sign of pelviperitonitis. this. Next is an agitated patient trying to look behind the door next to his room, claims about his friends are there and his punishment is occurring behind the wall, loudly repeats. So the patient feels that his friends are sitting behind the wall and deciding some punishment for him, which is not here in the real one. Not The patient is just feeling it. It's the question related to the psychiatry. The patient is just feeling about it. However, his friends are having no aim for his punishment or anything like this, right? So please remember the case over the acute hallucinations. This is something related to the acute hallucinations, that the patient feel as agitated. He tried to look behind the door next to the room, claims that his friends are trying to decide his punishment behind the wall. So remember that the patient is having the case of hallucinations, which is acute in nature this time. Next is some red beans are given by the examiner. So we have to remember about this, that these red beans are undercooked red beans, which caused 26-year-old patient caused nausea, vomiting and diarrhea. So which he ate 2 hours ago. What did he eat? He eats a red beans, some red beans he ate. What we are going to give to the patient now, sir? Phasing will correct this thing. So phasing, please remember, red beans, phasing, red beans, phasing. Remember about it, friends. Next is the case over our pleurisy. So 35-year-old patient shows weakness, excess sweating, fatigability, pain in the right side during breathing. Right side pain because probably there is fluid over there. Why fluid over there? Because the percussion detect dullness over there, and breathing is weak because lung is maybe getting collapsed over there. Right side of the chest, legs behind, because right side is filled with the fluid over there. And a case related to the atelectasis. Fever is there because bacteria might have caused the pleurisy. Respiration is high because the lungs are trying to compensate the effect of the right lung as well. Pulse is elevated because pulmo and heart system works together. Leukocytes are elevated because of bacterial infection. Lymphocytes and ESR is elevated because some infection is there. So sir, the case is really clear. The case is related to the exudative pleurisy. So next is people with tall limbs. So derealization, we have covered it in the psychiatric part. What is this? This is a quick quote for you, that there are no limits to our imaginations. If you can think it, you can do it. So if you can think about your goals, that you can get 100% marks, sir, if you think about it, if you have imagined it, you can do it. Nobody will be there to stop you. Never think about what have you lost already. Always focus on what you can do better today. Because if you will think about I have lost this much time, I have done this and this, so this will be just wastage of your energy, because you cannot change the things which you have done wrong already, or you have made some mistakes. So never think about what have you lost. Always focus on the what you can do better. Instead of focusing on what's wrong with the day, be thankful to what's good with the day. We have clothes to wear, we have food to eat. Just the weather cannot spoil your day, right? Sir, sun is not there today, that's why we are feeling depressed. So instead of focusing on what's wrong with the day, focus on what's positive with the day. Be thankful to what is good with the day. If you will do this, you will be naturally start to live in the present moment. And when you live in the present moment, you will make sure that you are not worried about future, you are not regretting about past anymore. You are living in the present moment and you are enjoying the present moment. So this is it with this video, and wait for my friend to comment in the comment box. And if you have better logic for some of the questions, please feel free to comment me in the comment box. And if there are some problems which are persisting, also let me know in the comment box. And see you with the next video.